What are the key steps in ensuring sterile technique during surgical preparation, and why is each step critical to the prevention of surgical site infections? Answer. Sterile technique is essential in surgical preparation to minimize the risk of infection. The critical steps include preparation of the surgery area. The surgery area must be cleaned and disinfected with appropriate antiseptic solutions, e.g., chlorhexidine or iodine-based solutions. This step reduces the number of microorganisms on the skin and surrounding environment, significantly lowering the risk of contamination. Sterilization of instruments. All surgical instruments must be autoclaved to ensure they are free from bacteria, viruses, and fungi. Autoclaving uses high-pressure steam to kill all microorganisms. Sterility indicators, such as color-changing strips, are used to confirm that proper conditions were met during sterilization. Gowning and gloving. The surgical team must wear sterile gowns and gloves. Gowns should cover all exposed skin, and gloves should be put on in a sterile manner to prevent contamination when touching sterile items. Patient prep. The patient should be prepped with antiseptic solutions. The area where the incision will be made is clipped, cleaned, and draped in sterile materials to ensure no contamination from non-sterile body parts or equipment. Each step is crucial because failure in any of these areas can lead to contamination, potentially causing infections like surgical site infections, SSI, which can lead to longer recovery times, additional treatments, and even systemic infections. Describe the essential elements of preoperative care for a surgical patient and explain why fasting is one of the most important steps. Answer. Preoperative care involves several critical components. Fasting. Fasting is typically required to reduce the risk of aspiration during anesthesia. When a patient is under general anesthesia, the muscles that control the esophagus and stomach relax, and the risk of regurgitation increases. Fasting ensures the stomach is empty, reducing the chances of inhaling food or liquid into the lungs, which could lead to aspiration pneumonia. Fluid therapy. Hydration is essential, especially in animals who are fasting. Administering intravenous Roman fluids ensures that the patient remains hydrated and supports circulation, particularly during surgery when blood pressure may drop due to anesthesia. Premedication. Administering preoperative medications such as sedatives or analgesics helps manage pain and reduce anxiety before surgery. Analgesics also help with post-operative pain management. The fasting period is important not only for preventing aspiration but also for optimizing anesthetic conditions, as a full stomach can interfere with the absorption of anesthetic drugs, leading to complications during surgery. Mr. Davis is preparing his dog, Bella, for an orthopedic surgery involving a hip replacement. Bella is a 5-year-old Labrador, and Mr. Davis is concerned about the pre-surgical care and preparation. What steps should Mr. Davis take in the pre-operative process to ensure Bella's safety during surgery? Answer. To ensure Bella's safety, Mr. Davis should follow these steps. Pre-operative consultation. Mr. Davis should have a thorough consultation with the veterinary surgeon to review Bella's medical history, including any underlying conditions such as heart disease or diabetes, which may affect anesthesia. Blood work should be done to ensure Bella's liver and kidney functions are normal. Fasting. Bella should be fasted for 1 to 18 hours before surgery to ensure her stomach is empty, thus reducing the risk of aspiration during anesthesia. Hydration. Bella should be provided with IV fluids to maintain hydration and to help with circulation during surgery. The IV catheter should be placed before anesthesia is administered. Premedication. A sedative or analgesic may be administered before surgery to help reduce anxiety and pain. A non-steroidal anti-inflammatory drug, NSAID, may be given for pain management, but it should be confirmed with the veterinary team. By ensuring these measures are taken, Mr. Davis will be minimizing Bella's risks during surgery and supporting her recovery post-surgery. In which types of surgery should the surgical team take extra precautions with regard to sterile technique, and why? Answer. The surgical team should take extra precautions with regard to sterile technique in orthopedic surgeries and emergency surgeries. Orthopedic surgeries. These surgeries often involve the placement of implants, such as plates, screws, or prosthetics, which remain in the body and can serve as a site for bacterial growth if not properly sterilized. Extra precautions, such as using double gloving, minimizing the length of the incision, and using antibiotic prophylaxis, are essential to prevent post-operative infections, which can lead to complications like osteomyelitis, bone infection. Emergency surgeries. In emergency situations, e.g., trauma, abdominal exploratory surgery, there may be less time to prepare the patient or the environment, increasing the risk of contamination. In these cases, the surgical team must be vigilant in maintaining sterile technique, even if there is a rush to perform the surgery. In such scenarios, appropriate sterilization of instruments, proper draping of the surgical site, and limiting traffic in the operating room are critical. Both types of surgeries are more prone to infection due to the invasiveness of the procedure, the presence of foreign objects, and the urgency that might reduce attention to sterile protocols. What are the primary challenges in post-operative care of a surgical patient, and what measures can be taken to minimize complications? Answer: post-operative care aims to prevent complications and ensure the patient's recovery is smooth. Key challenges include pain management. Adequate pain control is critical to prevent suffering and promote healing. Analgesics, including opioids, NSAIDs, and local anesthetics, should be administered as prescribed with careful monitoring for side effects. Monitoring recovery from anesthesia. After surgery, the patient must be carefully monitored as they recover from anesthesia, ensuring the airway is clear, checking for normal heart rate, and providing supplemental oxygen when necessary are vital tasks. Infection prevention. Keeping the surgical site clean and monitoring for signs of infection, e.g., redness, swelling, discharge, are essential. Antibiotic therapy may be prescribed prophylactically or based on surgical findings. The patient should be kept in a clean, controlled environment, and bandages should be changed regularly. Wound care. Proper wound care, including dressing changes and monitoring for signs of infection or dehiscence wound opening, is critical for a successful recovery. Patients should be prevented from licking or chewing their incisions to avoid contamination. Post-operative nutrition. Ensuring the patient receives appropriate nutrition, both in terms of fluids and food, is necessary for tissue repair and overall recovery. These measures minimize the risk of complications such as infection, delayed wound healing, or prolonged recovery. How should the surgical team handle instruments during surgery to maintain sterility and prevent contamination? Answer: handling instruments during surgery requires precise protocols to ensure sterility. Passing instruments. Instruments should be passed to the surgeon in a manner that ensures the sterile parts are never touched by non-sterile surfaces. The common technique is using the hands-off method, where the instrument is passed without direct hand contact. Instrument positioning. Instruments should be placed on sterile drapes or trays, ensuring they do not touch non-sterile surfaces. If an instrument is accidentally contaminated, it must be replaced with a new sterile instrument. Sterile field maintenance. The sterile field should be continuously monitored throughout the surgery. Any breach in sterility, such as a sterile drape falling, should be immediately addressed by replacing the contaminated drapes or instruments. Avoiding contamination of surgical site. Instruments should only be used for their intended purpose and should not come into contact with areas of the patient's body that are not part of the surgical site. This reduces the risk of introducing bacteria to non-surgical areas. Proper instrument handling is essential to maintaining a sterile environment and preventing infections. Mrs. Thompson's cat, Felix, underwent a soft tissue surgery to remove a tumor from his abdominal cavity. After surgery, Felix is showing signs of lethargy, increased heart rate, and a slightly elevated temperature. What steps should the veterinary team take to manage Felix's recovery and address these signs? Answer: the veterinary team should take the following steps. Pain management. Felix may be experiencing post-operative pain, which is common after soft tissue surgery. The team should administer additional pain relief either through injectable medications or oral analgesics as prescribed. Monitoring vital signs. The team should continuously monitor Felix's heart rate, respiratory rate, and temperature to ensure they are within normal ranges. An elevated heart rate and temperature may be indicative of infection or pain. Assessment of surgical site. The surgical site should be checked for signs of infection, including redness, swelling, or discharge. If an infection is suspected, the team may administer antibiotics as needed, IV fluids, and nutrition. Felix should be kept hydrated with IV fluids, and his nutritional needs should be addressed to support recovery. If Felix is unwilling to eat, the team may provide feeding tubes or offer palatable food. Comfort and rest. Felix should be kept in a calm, quiet area to recover, minimizing stress. He should also be monitored for any signs of discomfort or agitation. What are the specific considerations for post-operative care in patients undergoing orthopedic surgery, and how do they differ from soft tissue surgeries? Answer: post-operative care for orthopedic surgeries involves unique considerations. Pain management. Orthopedic surgeries, especially involving fractures or joint replacements, can be more painful than soft tissue surgeries. In addition to general pain management, localized pain relief through nerve blocks or epidural anesthesia may be required. Movement restrictions. Post-operative care includes strict movement restrictions to ensure proper healing of bones and joints. Monitoring for complications. Complications such as non-union of fractures, implant failure, or joint dislocation are specific to orthopedic surgeries. The veterinary team should monitor for signs of these issues during the recovery period, and radiographs may be necessary to assess the healing process. Physical rehabilitation. Once the initial recovery period is over, physical therapy, including passive range of motion exercises or hydrotherapy, may be used to improve the function of the affected limb. These considerations are more intensive compared to soft tissue surgeries, where movement and weight-bearing restrictions are less critical. What is the importance of maintaining aseptic techniques when assisting in orthopedic surgery, and what are some of the common violations that occur in the operating room? Answer: maintaining aseptic techniques in orthopedic surgery is vital to prevent infection, especially since the use of foreign materials like plates and screws can serve as an infection reservoir. Common violations include breakage in sterile field. If the sterile drapes are compromised or instruments are not properly handled, contamination can occur. Unsterile personnel. Non-sterile personnel moving in and out of the sterile field or touching sterile instruments can lead to contamination. Instrument handling. Using instruments that have not been sterilized or dropping instruments on non-sterile surfaces can introduce pathogens to the surgical site. Maintaining aseptic techniques ensures the success of the surgery and prevents the development of complications like infections or delayed healing. What factors should be considered when choosing an appropriate anesthetic agent for a surgical patient? Answer: when choosing an anesthetic agent for a surgical patient, the following factors must be considered. Patient's health status. Anesthetic agents should be chosen based on the patient's overall health. Animals with liver or kidney disease may require drugs that are metabolized differently or may need reduced dosages. Type of surgery. The anesthetic protocol may vary depending on the type of surgery. For example, orthopedic surgeries may require more potent analgesia compared to minor soft tissue procedures. Duration of surgery. Longer surgeries may require agents that provide longer-lasting anesthesia or that can be easily adjusted during the procedure. Recovery time. Some anesthetic agents have faster recovery times, which is critical in emergency surgeries or when quick patient mobilization is necessary. The selection should be tailored to the individual patient and the nature of the surgical procedure. A dog is found unresponsive after being hit by a vehicle. What are the key differences in performing CPR on a dog compared to a human, and what are the key steps involved in resuscitation? Include the relevant guidelines and regulations that veterinarians must follow in such emergency procedures. Answer: CPR for canine patients differs from human CPR primarily due to the anatomical and physiological differences. In dogs, chest compressions are typically performed with the hands over the widest part of the chest as opposed to human CPR where compressions are applied over the sternum. Steps involved in CPR for a dog: ensure a patent airway. Clear the airway by removing any obstruction. Start chest compressions. Place your hands over the chest and apply firm compressions approximately 1/3 of the chest depth at a rate of 100-120 compressions per minute. Rescue breaths. Deliver breaths to the dog's nose and mouth, ensuring the chest rises with each breath. Perform 2 rescue breaths for every 30 compressions. Repeat cycles. Continue until spontaneous circulation is restored or advanced veterinary care is available. Guidelines and regulations. Veterinary professionals must adhere to AAHA, American Animal Hospital Association, guidelines on CPR, which emphasize early recognition of cardiac arrest, proper chest compression depth, and balanced ventilation. A 5-year-old male cat presents with tachycardia, pale gums, and cool extremities. After thorough examination, the veterinarian diagnoses shock. What types of shock are commonly seen in veterinary practice, and what are the initial steps in shock management and fluid therapy? Answer: shock is a critical emergency condition that results in inadequate tissue perfusion. The most common types of shock in veterinary medicine include hypovolemic shock, caused by a significant loss of blood or fluid, e.g. hemorrhage, severe dehydration. Cardiogenic shock occurs when the heart is unable to pump blood effectively, often due to heart failure or arrhythmias. Distributive shock results from an abnormal distribution of blood flow as seen in conditions like sepsis or anaphylaxis. Obstructive shock due to a physical obstruction to blood flow, e.g. pulmonary embolism, pericardial tamponade. Initial steps in shock management. Stabilization. Prioritize airway management, breathing and circulation. Fluid therapy. Administer IV fluids to restore blood volume. The first choice is isotonic crystalloid solutions like lactated Ringer's solution or Normosolar. A typical initial bolus dose is 2.30 Ag for cats, administered rapidly over 1.5-3 minutes depending on the severity. Oxygen supplementation. Ensure adequate oxygenation to support organ function. Monitoring and adjustments. Monitor heart rate, blood pressure, and oxygen saturation continuously to assess response to treatment. Guidelines. Follow the ACVE CC shock management guidelines, which recommend rapid fluid resuscitation and appropriate adjustments based on patient response. Mr. Johnson is a pet owner who took his dog, a 7-year-old Labrador, for a long walk on a hot summer day. Upon returning home, the dog is panting heavily, drooling excessively, and seems weak. Mr. Johnson is concerned that the dog may be suffering from heat stroke. What immediate actions should Mr. Johnson take to help his dog, and what are the key factors in diagnosing and treating heat stroke in dogs? Answer: heat stroke is a life-threatening condition in dogs that occurs when the body's temperature regulation fails in response to excessive heat. The key signs include excessive panting, drooling, weakness, confusion, and in severe cases, collapse or seizures. Immediate actions for Mr. Johnson: move the dog to a cool, shaded area. This will help reduce environmental heat exposure. Cool the dog gradually. Use cool, not cold water to wet the dog's body. Applying ice packs to the groin and armpits can help lower body temperature. Monitor temperature. Use a rectal thermometer to check the dog's body temperature. Heat stroke is diagnosed when the body temperature exceeds 140°F. Offer water. Allow the dog to drink small amounts of cool water if it is able to do so. Avoid giving large amounts at once. Seek veterinary care immediately. Heat stroke can lead to organ failure, and the dog may need IV fluids, medications, and continuous monitoring in a veterinary emergency setting. Guidelines: according to the AHA emergency guidelines, it is important not to cool the dog too rapidly, using ice baths, as this can cause vasoconstriction and worsen the condition. A 2-year-old German Shepherd dog presents with a deep laceration on its hind limb following an accident. The wound is actively bleeding, and the dog is showing signs of shock. What are the key steps to manage hemorrhage in this situation, and what should be done to stabilize the dog for transport to the veterinary clinic? Answer: when managing hemorrhage, the primary goal is to control bleeding while preventing shock. The steps involved are: apply direct pressure. Use a clean bandage or sterile gauze to apply direct pressure to the wound. If bleeding continues, add more gauze and continue applying pressure. Elevate the limb if possible. This helps reduce blood flow to the affected area and can reduce bleeding. Tourniquet application as a last resort. If bleeding is severe and cannot be controlled with pressure, a tourniquet can be applied proximal to the injury site, but this should only be done in extreme cases to avoid further damage to tissues. IV fluid therapy. Administer IV fluids to combat hypovolemic shock, aiming to restore blood volume and stabilize circulation. An appropriate crystalloid solution, e.g. lactated ringers, should be given at 2 30 G/15, 30 minutes. Prepare for transport. The dog should be stabilized and transported to a veterinary facility for further evaluation and possible surgical intervention. Mrs. Clark notices that her cat Whiskers has been acting lethargic and vomiting after she suspects the cat may have ingested some rat poison. What are the immediate steps that Mrs. Clark should take to address potential poisoning, and what treatment protocols should be followed in the veterinary setting? Answer: the first step for Mrs. Clark is to contact a veterinarian immediately to discuss the situation, as some types of rat poison, like anticoagulants or rodenticides containing brodifacoum, can cause delayed effects. Immediate actions for Mrs. Clark: prevent further exposure. If the poison is still available to the cat, remove it from the environment. Induce vomiting, only if recommended by a veterinarian and if the cat is not showing severe clinical signs, e.g. seizures, lethargy. This can be done by administering hydrogen peroxide, 3% in doses as directed by the vet. Transport to the vet. Whiskers should be transported to a veterinary clinic for evaluation and treatment. In the veterinary setting, activated charcoal, administered to limit further absorption of the toxin. Antidote therapy. If anticoagulant poisoning is suspected, administer Vitamib-K to reverse the effects of bleeding. Monitoring. Blood work will be done to assess organ function and clotting ability. The cat has sustained a significant trauma with multiple injuries, including a suspected fracture of the femur and a severe contusion. What is the first priority in managing this critically injured patient, and how should the veterinarian stabilize the cat for transport to an emergency clinic? Answer: when managing trauma patients, the first priority is stabilization to prevent further injury or complications. Airway, breathing, circulation, ABC. Ensure the airway is clear, provide oxygen if needed, and assess circulation. Control external bleeding. Apply pressure to any open wounds or fractures to reduce bleeding. Splint fractures. Immobilize the suspected fractured limb to prevent movement and further damage. Pain management. Administer analgesics as appropriate to control pain and reduce stress on the animal. IV fluid therapy. If signs of shock are present, Start fluid resuscitation with an isotonic solution like lactated ringers at a rate of 2 euro, 3 euro Ag over 15 minutes and continue at a slower rate. Guidelines. According to the ACVE CC Trauma Management Protocol, early intervention in managing bleeding, pain, and shock can dramatically improve patient outcomes. A 10-year-old cat is being monitored in the ICU after undergoing surgery for a large abdominal tumor. The cat's heart rate is elevated and the blood pressure is low. What are the key factors to assess in this critical patient, and how should the veterinary team proceed with monitoring and supportive care? Answer. In critical care, continuous monitoring of vital signs is essential to assess the patient's response to treatment. Key factors include heart rate. An elevated heart rate may indicate pain, fever, or stress. The target for a stable cat is 140-22 BPM. Blood pressure. Hypotension, low blood pressure, can be a sign of shock, bleeding, or dehydration. A normal systolic blood pressure for a cat is 120-148 G. Oxygenation. Ensure oxygen saturation levels are maintained above 90%. Pain management. Administer appropriate analgesics such as opioids or NSAIDs to keep the patient comfortable. Fluid therapy. Continue IV fluids to maintain perfusion and replace any lost fluids, just based on ongoing assessments of hydration status and blood pressure. Guidelines. According to the ACV CCIC UK guidelines, multimodal therapy and careful adjustment of fluids and pain management are critical for supporting critically ill patients in the ICU. A 6-year-old cat has been struck by a car, and the owner reports that the cat is having difficulty breathing and is bleeding from its mouth. What should the veterinarian do to immediately assess and stabilize this trauma patient? Answer. Immediate stabilization is essential to ensure the survival of a trauma patient. The veterinarian should perform the following. Airway assessment. Ensure the airway is open, as trauma to the chest can cause obstructed breathing. Breathing support. Administer oxygen through a mask or nasal cannula if the cat shows signs of respiratory distress. Control hemorrhage. Apply pressure to any external wounds to control bleeding. Fracture stabilization. If fractures are suspected, immobilize the affected areas to prevent further injury. Shock management. Administer IV fluids to combat hypovolemic shock. Guidelines. According to ACV CC Trauma Guidelines, the focus is on early airway control, fluid therapy, and pain management to stabilize the animal for further diagnostic evaluation. An animal has been stabilized after emergency surgery and is now in the ICU. What are the most important factors to monitor in the ICU to ensure the patient's recovery, and how should the veterinary team proceed with managing its recovery? Answer. The critical care team must continuously monitor the following: heart rate and blood pressure. These vital signs should be kept within normal limits. Monitoring mean arterial pressure map is key to assessing perfusion, respiratory status. Oxygen saturation should be continually assessed, and respiratory rates should be monitored for signs of distress or hypoxia. Urine output. Monitor for adequate urine production, typically an indicator of kidney function. Nutritional support. Provide feeding via a nasogastric tube or IV fluids if the animal is unable to eat on its own. Guidelines. The ACV CCICU guidelines emphasize that careful monitoring of vital signs, fluid balance, and organ function is crucial for the recovery of critically ill patients. A dog is suspected to have ingested a toxic substance, and the veterinarian is unsure of the type of toxin involved. What steps should the veterinary team take to assess the situation and provide immediate care for the poisoned patient? Answer. The first step in managing suspected poisoning is identification of the toxin if possible. The steps include history taking. Obtain detailed information from the owner about potential access to toxins. Clinical signs. Assess the animal for symptoms such as vomiting, diarrhea, seizures, or respiratory distress. Activated charcoal administration. If ingestion occurred within the last hour and the toxin is not caustic, activated charcoal can be administered to reduce absorption. Supportive care. Administer IV fluids and oxygen if required. Treat clinical signs such as seizures with appropriate medications, e.g. diazepam for seizures. Antidote administration. If the specific toxin is known, administer the appropriate antidote such as naloxone for opioid toxicity or vitamin K for rodenticide poisoning. Guidelines. The ASPCA Animal Poison Control Center provides specific guidelines on managing various types of toxins, including appropriate treatments and antidote protocols. A veterinarian technician is presented with an animal that is suffering from a severe and chronic illness. The veterinarian recommends euthanasia, but the owner is hesitant, wanting to explore all other options first. What ethical considerations should the veterinary technician take into account when assisting with this decision? Answer: the veterinary technician must navigate the ethical principles of beneficence and non-maleficence, which are central to making humane decisions in veterinary practice. Beneficence refers to acting in the best interest of the animal, ensuring that it receives appropriate care to alleviate suffering, while non-maleficence requires avoiding harm. In this case, the technician must consider the animal's quality of life. At the same time, the technician should respect the autonomy of the client. The client has the right to make decisions regarding their pet's care, but those decisions must be based on informed consent. This means the technician should provide the client with all necessary information about the prognosis, the potential suffering the animal may experience if treatment is continued, and the likely outcomes of the treatment options available. The technician should also maintain a compassionate and empathetic approach, acknowledging the emotional difficulties the client may be facing while supporting the veterinarian's medical judgment. Ethical guidelines, such as those from the AVMA, American Veterinary Medical Association, emphasize minimizing animal suffering through humane euthanasia when recovery is not possible. A veterinary technician receives a request from a third-party individual not related to a patient's care asking for a copy of the medical record of a client's pet. The client has not authorized the release. What should the technician do in this case? Answer: the veterinary technician has a strict legal obligation to maintain patient confidentiality as per the Health Insurance Portability and Accountability Act, HIPAA, and state-specific veterinary practice laws. The HIPAA privacy rule ensures that protected health information remains confidential and is only disclosed with the patient's consent or in certain legally defined situations. In the context of veterinary care, patient confidentiality extends to the animal's medical records. The technician should first confirm that the request for records is legitimate. Since the individual making the request is not authorized, the technician must deny the request and explain that only the owner or authorized representative can access the medical records unless specific consent has been given. If the request involves a subpoena or court order, the technician must follow the legal procedures to ensure compliance with the law. In these cases, the veterinarian and clinic management must ensure that the release of information is in line with the applicable laws and regulations, taking care to protect the integrity of the client's confidentiality. Additionally, the technician should ensure that the clinic has clear documentation of any requests for records and the actions taken in response. Dr. White is working in a clinic with limited resources. She has two critical patients: a dog suffering from severe pancreatitis and a cat that requires immediate surgery after being hit by a car. The clinic can only afford to treat one of them. What ethical principles should Dr. White consider when deciding which animal to treat first? Answer: in a situation involving limited resources, Dr. White must make an ethically sound decision guided by principles such as justice, beneficence, and fairness. The principle of justice dictates that resources should be allocated fairly. This requires Dr. White to consider the prognosis and likelihood of successful outcomes for each patient. The principle of beneficence requires Dr. White to act in the best interest of both animals, which means she needs to assess the severity of each condition and the potential for alleviating suffering. If one animal has a significantly higher chance of survival or recovery with immediate treatment, that animal should generally be prioritized. Additionally, non-maleficence, avoiding harm, is central to making such decisions. Dr. White must carefully weigh whether delaying treatment for one of the patients would result in unnecessary suffering or harm, especially if one animal's condition is more life-threatening than the other. Dr. White should also take into account any client preferences and any possible ethical obligations to each owner, as long as those preferences align with medical necessity. In some cases, both clients may need to be informed of the clinic's resource constraints and the difficult choices being made. Transparency in communication is vital in these situations to manage client expectations and foster trust. In an ideal scenario, Dr. White might consider alternative solutions, such as reaching out to other clinics or organizations for additional resources. Ultimately, the decision should be based on the principle that the animal's welfare is the primary concern, while ensuring that both clients feel respected and informed. Mr. Johnson brings his pet dog Max to the clinic for an examination. He has been visibly stressed and anxious about Max's condition. How can the veterinary technician build rapport with Mr. Johnson and help him feel more comfortable during the examination? Answer: building rapport with Mr. Johnson is essential to fostering a trusting and collaborative relationship in the clinical setting. The veterinary technician can start by employing active listening to acknowledge Mr. Johnson's concerns. This includes making eye contact, nodding, and expressing empathy, such as saying, "I understand that you're worried about Max, so we're here to help." Next, the technician should ensure they communicate clearly and professionally, explaining what will happen during the examination using simple language, and answering any questions Mr. Johnson might have about the procedure will help reduce his anxiety. The technician should also acknowledge any potential concerns or fears Mr. Johnson has, such as concerns about pain for Max, and reassure him that steps will be taken to ensure Max's comfort. Non-verbal communication is also key to building rapport. A calm, steady tone and relaxed posture can help Mr. Johnson feel more at ease. If the technician is able to use touch, such as gently petting Max during the examination, this can provide comfort to both the pet and owner, creating a sense of connection. A newly graduated veterinary technician begins working in a practice that does not provide proper supervision of the technicians and allows them to perform procedures beyond their scope of practice. What legal issues could arise from this situation, and what should the technician do? Answer: performing procedures beyond the veterinary technician's legal scope of practice can expose both the technician and the practice to significant legal risks. Veterinary technicians are typically governed by state veterinary practice acts, which define the specific duties they are allowed to perform under the supervision of a licensed veterinarian. These duties generally exclude activities that involve diagnosing conditions, prescribing medications, or performing surgeries without veterinary oversight. If a technician performs tasks beyond their licensed scope, they may be guilty of negligence or malpractice, resulting in legal consequences, including fines, suspension, or revocation of licensure or lawsuits. Furthermore, performing unauthorized procedures may place the health and safety of the animal at risk, which could lead to ethical and professional repercussions, such as damage to the clinic's reputation and potential harm to the technician's career. The technician should immediately report the issue to the practice owner or supervisor, outlining the potential legal violations involved. If the practice refuses to correct the situation, the technician should contact the state veterinary licensing board for guidance. Mrs. Green comes to the clinic with her pet cat, Whiskers, who has been diagnosed with an incurable condition requiring costly medications. She expresses concern about the financial burden. As the veterinary technician, how should you approach this conversation to balance the emotional and financial aspects of the situation? Answer: when dealing with Mrs. Green's concerns about the financial burden of Whiskers' treatment, the veterinary technician must be empathetic, transparent, and solution-focused. The technician should first acknowledge Mrs. Green's emotional distress by saying something like, "I can understand how difficult this situation must be for you, and I want to help you explore all your options." And next, the technician should ensure that Mrs. Green is fully informed about the diagnosis, prognosis, and treatment options. It's important to discuss the costs involved clearly, while also offering a range of possible treatment plans, from more intensive options to more affordable alternatives if available. If the clinic offers payment plans or financial assistance programs, these should be discussed with the client as possible solutions. The technician should also ask Mrs. Green if she has any concerns or preferences regarding Whiskers' care, and discuss the possibility of palliative care or quality of life-focused treatment if curative treatment is not feasible. At all times, the technician should be sensitive to Mrs. Green's emotional state and provide reassurance that the clinic's goal is to support her and Whiskers through the difficult decision-making process. The technician is working with a dog that is undergoing a post-operative recovery period after surgery. The dog is showing signs of pain, such as panting and restlessness. What are the ethical and practical steps the technician should take to manage the dog's pain effectively? Answer: effective pain management is essential to ensuring both the ethical treatment and well-being of the animal. The veterinary technician should first assess the dog's condition using pain assessment tools, such as the Visual Analog Scale, VAS, or Colorado State University Canine Pain Scale, to determine the severity of pain. Ethically, it is the technician's responsibility to advocate for the animal's comfort and ensure that it is receiving adequate pain relief. This may involve administering the appropriate pain medications as prescribed by the veterinarian. Common options may include NSAIDs, nonsteroidal anti-inflammatory drugs, opioids, or local anesthetics. Additionally, the technician should monitor the dog's vital signs and comfort level closely, noting any changes in behavior or signs of discomfort. If the dog's pain appears to be inadequately managed, the technician should inform the veterinarian to adjust the treatment plan, potentially adding stronger analgesics or addressing the underlying causes of the pain. The technician should also reassure the owner and discuss any aftercare requirements, such as at-home pain management, signs of complications, and follow-up care, to ensure that the dog's pain is effectively controlled long-term. A new veterinary technician has joined the clinic and is having trouble adjusting to the fast-paced environment. How can senior staff help this technician integrate effectively into the team and perform their duties with confidence? Answer: Effective teamwork and clear communication are key to helping the new veterinary technician integrate smoothly into the clinic. Senior staff should take a proactive role in offering support by assigning a mentor or experienced technician to guide the new employee. This mentor should offer practical advice, answer questions, and provide emotional support during the adjustment period. Training should focus on both the technical skills and the workflow systems of the clinic. Senior staff should demonstrate the importance of prioritizing tasks and staying organized, helping the technician to manage time effectively in a fast-paced environment. Additionally, providing feedback on the technician's performance and offering constructive suggestions for improvement will help build confidence and trust within the team. Communication should be open and clear, with senior staff being approachable for questions and concerns. Establishing regular check-ins with the technician to discuss challenges and progress will also help to alleviate feelings of isolation and anxiety. Positive reinforcement for good performance will help the technician feel supported and valued as part of the team. A client insists on using an alternative treatment for their pet despite your concerns about its effectiveness. How should the technician approach this situation while balancing respect for the client's autonomy and the animal's well-being? Answer: in this scenario, the veterinary technician must respect the client's autonomy while prioritizing the animal's well-being. The technician should start by listening to the client's reasoning for choosing the alternative treatment and expressing understanding of their concerns. This will help build trust and rapport, allowing for a more constructive conversation. The technician should also explain the potential risks of the alternative treatment based on available scientific evidence while remaining non-judgmental. If the alternative treatment is unproven or potentially harmful, the technician should express their concerns clearly to the client and provide information about other scientifically supported treatments. If necessary, the technician should involve the veterinarian to discuss the matter in greater detail with the client. Ultimately, the technician should ensure that the client's decision is informed and that the animal's safety is not compromised. The technician can continue to offer support by suggesting follow-up appointments or alternatives that may address the client's concerns in a safer way. A veterinary technician is asked to work overtime on short notice. Although the technician is already tired from a long shift, they are reluctant to refuse because they do not want to appear uncooperative. What should the technician consider before agreeing to work overtime? Answer: before agreeing to work overtime, the veterinary technician should consider their own physical and mental well-being. Overworking when tired can lead to fatigue and decreased performance, which can negatively impact the quality of care provided to animals. The technician should evaluate whether they are in a condition to work safely and effectively, as working while fatigued may increase the risk of making mistakes. If the technician feels unable to work effectively due to exhaustion, they should communicate respectfully with their supervisor about their concerns. It is important to maintain a balance between being a cooperative team member and protecting one's own health. The technician can propose alternative solutions, such as offering to work a shorter shift or offering to cover a shift on another day. By making sure they are well rested, the technician can ensure that they are providing high quality care to the animals and maintaining professionalism in the clinic.